Good afternoon and welcome to HealthSystemCIO.com's All-Stars panel, Keys to Doing IT Asset Disposition the Right Way, a webinar tweet chat combo from HealthSystemCIO.com sponsored by Iron Mountain. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com and I will be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our Managing Editor and Director of Social Media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat. You can also view the tweet chat in the Media Viewer panel on the right-hand side of your screen. We'll also be using our Q&A panel today. You can use that to send in your questions as they occur to you and leave the default set to all panelists. We'll take those later in the program. And we're also going to put out a poll question today, and our polling panel will open automatically when we launch it. And you can download the deck by using the URL on your screen. It's at the bottom of our slides, and it is also being sent out in the chat box. Just so you see how we're going to spend our time today, we're going to go about 35 minutes with our main panel discussion featuring Neal Ganguly, VP and CIO at JFK Health System, Michael Archuleta, CIO and HIPAA and Information Security Officer at Mount St. Rafael Hospital, and Brooks Hoffman, Principal with Iron Mountain. So without further delay, we are going to jump right into our discussion. Neal, can you give us an overview of your organization and role?
Sure. JFK Health System is a community hospital system in central New Jersey. We're 498 beds on the acute side. We have 4 long-term care facilities and a variety of ambulatory facilities and clinics in the community and serve a couple of counties in central New Jersey.
Very good. Michael?
Hello, my name is Michael Archuleta, CIO for Mount San Rafael Hospital. We're part of the Bridge Care Health Network, so we basically have 5 facilities around the southern Colorado area, focusing from critical access to level 2 trauma centers to clinics, ambulatory care scenarios, and really focusing a lot on really doing a lot of digital transformation within the organization, looking at improving efficiencies and creating efficiencies for physicians on, allowing them to be doctors, and then of course implementing and utilizing technology to the fullest to really improve the overall patient care, which is at the end of the day the reason why we're all here.
Excellent. Brooks, a little bit about Iron Mountain and your role there.
Sure thing. Iron Mountain is a global business dedicated to storing, protecting, and managing information and assets. Approximately 95% of the Fortune 1000 trust us to store and protect their information and assets. We currently offer secure e-waste and IT asset disposition services in 15 countries on 5 continents. Some people are a little confused when they hear we're in this business. They associate us with records management or document destruction. But it really makes sense when you think of it because it fits well into the life cycle of data management, since many of these assets are data-bearing. My role at Iron Mountain is that I serve on the product management team, and among my responsibilities are communication both externally and internally, and also deploying and rolling out our service internationally.
All right, very good. Thank you for that. Michael, let's start with you. Tell us a little bit about your ITAD process.
Yeah, absolutely. So, with our ITAD process, we really tried focusing on an overall asset life cycle, really looking at how do we implement a successful ITAD program here at our facility. So, our number one goal was we really needed to identify and really define the requirements and goals of the organization. And then, of course, we were looking at involving all the affected parties in the development and the implementation of our ITAD program. And what's critical, too, is I think when you look at creating an overall successful ITAD program, you have to really look at establishing good policies consistently with goals and requirements of your organization, which I think is extremely critical. I think a lot of organizations at times really forget about policies and procedures, which basically makes a process or breaks a process. and really looking at, the tools to really, procure and apply tools to manage assets, really throughout their life cycle. And then another critical thing, which is always extremely important, is always adopting all of these specific elements, is adding and incorporating training, training of staff, and holding them accountable, to the policies and expectations that your organization have. Because it is extremely critical, because as we know, information privacy is really a huge concern in healthcare. And a good example of, a health organization that was recently charged more than $1 million for a data breach from a retired copier is problems that we're basically faced with, because organizations forget where information privacy is basically stored, which is extremely critical. And having an overall successful asset management of where all your PHI, where your data, where your sensitive information is basically stored is extremely critical to the overall success of your organization. And I think implementing processes to evaluate and continually improve the overall systems has also been a good success at what we've been kind of looking at doing. And looking at integrating solutions with providers to really benefit from additional resources, and looking out towards like Brooke and his group, Iron Mountain, which is, has been a very good asset and a business partner to our organization, has always been extremely critical. So I think trying to incorporate, specific elements to really build on your program is extremely critical. But like when I say training, and trying to implement those processes and making sure that the policies and procedures are basically in place, and having individuals understand the needs and understand what can happen if a device is breached, or if something basically gets exposed from a retired device, which at times we don't put into mind. And when we think about this copier, that was basically a retired device, and an organization was charged more than $1 million for this data breach, we have to reevaluate our overall strategy as well too. So it's really been a good incorporation of what we've done as an organization, of really understanding the overall aspect and the importance of what ITAD can really do to an org.
Very good. Thank you for that answer. Neal, a little bit about your ITAD process.
Well, Michael certainly gave a very comprehensive answer, and I think we have similar philosophies and directions to what he expressed. Policies and procedures are critical, of course, as is the compliance with those policies and procedures. We've been trying to put a lot of emphasis on the management side, that life cycle management that Michael mentioned, and just even simply sort of the asset tracking piece of that, where we've focused a lot now on getting very granular in our asset tracking, so we're not just tracking, for example, the PC, but we're tracking the key components that comprise that PC, like the hard drives, et cetera, and the serial numbers down to that level, so we can track those through the complete life cycle from acquisition to eventual destruction. Of course, as a not-for-profit community-based health system, our goal is to extend the life of these assets to the greatest extent possible and repurpose them where possible, et cetera. But we have made a real focus on keeping the tracking of those assets and tracking them to the level of also understanding which ones are PHI sensitive, I think, as Michael mentioned. So similar to Michael's, perhaps not as robust, certainly as I heard him express, but I think we're in sort of the same mindset.
Neal, let me just follow up with you. So is it fair to say that different health systems, maybe based on their resources, would have different life cycle goals for their equipment? One may say we're going to refresh more often than another because they have the ability to do so?
I think that's fair to say. Some organizations are able to just go on scheduled refreshes or even work with their hardware providers to say, we're going to just refresh all clinical devices on a 3-year cycle or something along those lines. An organization like ours at JFK, where we're very cost sensitive, we may take those 3-year-old clinical devices and repurpose them to back office areas and get extended life out of them.
Michael, any thoughts around that? I mean, what's your sort of approach to getting the most value out of the equipment you have versus refreshing it to get new equipment that maybe will be more robust?
Well, you know, it's pretty similar to Neal's process as well too. We have specific standard refresh cycles in place. We try to really do an overall refresh within a 3-year time frame. But we look at trying to identify high to low risk areas within the organization on where information privacy basically is stored. Because as I stated too, a problem that I see, especially with a lot of these breaches that are basically happening, is organizations really don't know where all of their information privacy or their personal health information is basically stored. You know, it is extremely, you know, critical because it is, you know, HIPAA privacy and a security rule to really, it requires that the covered entities really implement policies and procedures to address the final deposition of electronic PHI. So as organizations, we need to come out with good implementations, good procedures to remove the electronic PHI from electronic media or anything that we're basically getting rid of as well too. But as I stated though, is seeing a lot of orgs, seeing and reading about these breaches, I mean, who would even know that a copier would have patient information? And, you know, moving forward, especially with healthcare, I think we've always looked at, you know, technology really being behind the curve in a healthcare group versus, you know, a finance group. We're seeing the rise of cybersecurity really being an overall main concern within the organization. The importance, the rise of the CISO, you know, where the CISO really focuses on, you know, 4 really big elements, which, you know, comply, educate, manage risk, really govern and manage the overall process of what is coming in and what is coming out and keeping the organization as safe as possible. And it's always critical as well too, looking at that asset management process and procedure, is really looking at the asset life cycle of the overall process. Because the thing is if you don't have a good life cycle in place, you don't have a good understanding, you don't have a good understanding of where all your information privacy is basically stored, you will have some problems at the end of the day. And, you know, it's really critical to try to create a strategy that's going to improve on these aspects and really create elements to creating a successful IT asset deposition management process.
Excellent. Thank you, Michael. All right, Neal, let's go with you on this question. Tell us how each of the following issues factors into your hardware decommissioning approach. Cost, environmental concerns, or data security, and data security. You don't have to take all of them, but however you want to answer that. Cost, environmental concerns, data security.
Sure. From a cost perspective, I think, as I mentioned, our goal of trying to repurpose the equipment to the greatest extent possible and get as much useful life out of it as reasonably possible is a philosophy at JFK. Much like what Michael was saying, in critical areas like clinical-facing areas, we do the routine refresh, the 3-year refreshes, but we take that equipment, which often has useful life still, and we move it to back-office areas or sometimes to ancillary clinical areas that may be using lower levels of equipment or have lower-level equipment needs. So that's a big part of our cost strategy around asset management overall. On the environmental side, you know, I don't have a lot to say there. I think the organization we contract with to help on the disposal side of things is certified as an R2 vendor, or I think it stands for Responsible Recycling Vendor. But you know, our goal obviously is to try to ensure that they're not irresponsibly disposing of equipment, but I'm not as well versed on the specific environmental concerns that may exist there. And then, of course, on the security side, Michael mentioned having the CISO involved, and our CISO is heavily involved in that process. Even devices that are being repurposed or fully reformatted, erased, and then re-imaged before being deployed. Michael made a great point, and I think one of the things that we have to realize as CIOs is that there are other areas that involve technology that don't always fall under our scope, and the printers historically have been a great example of that, because a lot of times it was purchasing or materials management that had responsibility for getting the printer contract or the copier contract, and we didn't necessarily have a sense these devices all had hard drives in them that were retaining significant amounts of information a few years ago. Now, of course, I think most folks are aware of that. But what are those other areas? And as you get into more complex health systems, academic health systems, where you have a lot of different political groups who are maybe acquiring their own technologies, how do you maintain control over that? From a security standpoint, I think is important. And Michael mentioned the policies and procedures that have to be around, that have to be adopted across the enterprise, not just something that IT puts out there and people choose whether or not they want to adopt.
Very good. Thank you, Neal. I want to get to the next question. Michael, let's address this one to you. In a health system, which individuals do healthcare IT executives need to work with when it comes to ITAD? And what is the CISO's role? And interestingly, you're kind of wearing both hats.
Absolutely. So I'm not gonna sound like a broken record in regards to the CISO, but when I look at 4 functions that the CISO has, they basically look at prevent, shield, defend, prevent, monitor, hunt, detect, respond, recover, sustain, govern, manage, comply, educate, and manage risk. And I may sound like a rapper and a poet, but I'm not. But this is the thing, though, ladies and gentlemen. You know, with the rise of the CISO, really looking at managing the overall risks of the organization is extremely critical. We look at these specific items broken up into, 4 functions, which is extremely critical. At times, when the rise of the CIO came in place and basically started shocking everyone going into the executive suites, etc., you really saw that massive change of digital transformation. We now live in the digital age of healthcare. The CISO is such an important member of the organization, of the executive team, especially of looking at, governing and managing the risks that are associated with the organization. As I stated, and I bring it back because it's such a simple thing, a retired copier, having an actual data breach that cost an organization $1 million is an issue. That's why it's extremely important that CIOs really incorporate the CISOs and that the executive suite really work with that specific group. Because with digital transformation came the CIO, the CDO, then of course with digital transformation comes managed risks, which really are cybersecurity risks that need to be focused towards the CISO. And with data all around us now, it becomes an issue. And we look at it, we know that data is now the new oil, and we really focus on the improvements of data and how data can really improve the overall aspect and the care of a specific patient. But data also there's also risk associated with data. And when it comes to looking at organizations to basically help out with the ITAD process, it's really important that we make sure that they are fully meeting those HIPAA privacy and security rules, which is extremely critical as well too. And what we've also incorporated too is we also incorporate the support of our Chief Compliance Officer in the environment of the CISO role as well too. Because compliancy is really going to make a big aspect of making sure that we are really establishing our policies consistently with the overall goals and the requirements of the organization, which is going to be extremely critical in moving in the success of doing it. So looking at CIO, CISO, CCO, which is extremely critical to the success of developing your ITAD process. And those are some great individuals to start with in moving and building your successful program as well too.
Anthony, this is Brooks. If I could just expand a little bit on what Michael said, I would also add to that in terms of multiple stakeholders that, sometimes ITAD resides in multiple departments within an organization. It could be in purchasing, it could be in compliance, environmental health and safety, finance, so, you know, getting all of the stakeholders involved in the process and looking at it from their perspective in terms of what their needs are, what their goals are, and what the risks that are unique to their particular part of the organization, I think is an important aspect of this process.
And, you know, just to jump off of Brooke's statement as well, too, Anthony, you know, really looking at those multi-stakeholders is extremely critical. But what I also look at, too, is you really need to incorporate the training and the understanding of what this specific program basically has. Because when it comes to cybersecurity, when it comes to data breaches, I mean, if you look at a national poll that went out, and we could talk about ransomware some other time, only 43% of individuals nationwide knew what this was. So when you start saying, well, you know, your device contains PHI, which could be a data breach, I mean, you really have to explain this process and allow them to build a good culture of understanding, which is extremely critical. When I look at this and I speak about cybersecurity, building a security culture in an organization is extremely critical, period. Because the thing is the cultures in healthcare are not really focused towards, well, I'm going to have to grab my printer, it has personal health information. Individuals really don't care about that, but really trying to allow them to understand what can happen operationally, what can happen financially, what can happen to the reputation of a data breach, and understanding of where does PHI basically reside. And as Brooke stated, you know, it is extremely critical to involve those individuals, department head, department directors, understanding what affected areas, what items do they have stored in their systems that can be considered a data breach if not disposed of properly.
Excellent, excellent, gentlemen. Thank you very much. Brooks, let's go with you on this one. What parts of ITAD is it easy to get wrong, and how can trying to save a few bucks in this area cost you big time in the long run?
Well, I could probably write a book about this one, but if I had to boil it down, you know, and it's a cliche, but it's true in this industry as in many others. You know, you get what you pay for, and a lot of companies focus solely on price, and they forget about kind of the quality aspect of what they're doing and the risks involved. You know, the easiest way for an ITAD vendor to lower costs is to cut corners. You know, don't erase the hard drives or send the equipment that doesn't have end-of-life value, load it into a container and send it overseas or dump it in a landfill. You know, that reduces their costs, but obviously it significantly increases environmental and data privacy risk to your organization. And, you know, I think Michael might have touched on this earlier, but the biggest risk, you know, we talk about data privacy risk, we talk about environmental risk. The biggest risk to noncompliance is the risk to your organization's reputation. I mean, you think about some of these announcements of public companies and what happened in their market cap the next day. You know, it can cost hundreds of thousands, if not millions of dollars in market cap. It can destroy your brand equity. It can impact your sales, and you know, it goes well beyond just the dollars and cents involved of a particular data breach.
Brooks, do you think that if one health system, this happens all the time, there's a lot of acquisitions in healthcare, if a health system is looking to acquire another health system or even an independent hospital, are they going to review that organization's ITAD policies because they might be concerned that going cheap or doing this incorrectly could put them at risk post-acquisition?
Well, they definitely should as part of their due diligence because it's a potential liability and a very significant one. So I think, you know, as they're going through and reviewing policies, procedures, compliance issues, you know, ITAD is a natural part of that process.
All right. Very good. We're going to do a quick poll here. You see it in front of you, and we're opening that right now. Do you handle or have your vendor handle data destruction on-site or off-site? Either do it by yourself on-site, you have a vendor do it on-site, or a vendor do it off-site. If you could answer that question, we would appreciate it, and we'll take a look. We'll leave that open, and we'll take a look at the answers in a moment. So please go ahead and participate. We really appreciate it. All right, next question. Brooks, we're going to stick with you. When selecting a third-party ITAD vendor, what types of certifications should hospital executives look for?
You know, that's a very topical issue right now, and there are lots of certifications out there, which I think has created a certain amount of confusion. Basically, there are three different major types of third-party certification. The first category I would refer to as international management standards. These are things like ISO 9001, which addresses quality management, ISO 14001, which addresses environmental management, and OSAS, which is OHSAS 18001, which addresses occupational health and safety. So these are set by the international standard organizations, and many of you are probably familiar with them because they cut across a variety of industries, not just the ITAD industry. The next group of certifications are ITAD best practice certifications. They're specific to the ITAD industry. They were developed in conjunction with companies that provide ITAD services. Examples of this are eStewards, which is administered by the Basal Action Network, R2, which is responsible recycling, which is administered by CIRI, and RIOS, which is the Recycling Industry Operating Standard, which is administered by ISRI. Again, these are specific to the organization, and they address a variety of issues that relate to environmental health and safety, compliance, facility security, data privacy, et cetera. The last set of standards that are important are the data security standards. And the best example of this is the National Information Destruction, or NAID, their AAA plus certification. And they certify organizations who do both on-site and off-site data destruction to make sure that they are fully compliant with all regulations, that they have a secure process, that they maintain chain of custody, et cetera. The common point in all these standards is that they ensure that the certified party is in compliance through periodic third-party audits. So you're not just taking the vendor's word for it that they're doing things the right way. You have a third party that goes in there and literally audits them on site and goes through their processes and their documentation on a regular basis.
Very good. Excellent, Brooks. Thank you. We're going to take a look at our poll results, and we see that by a slight majority does vendor offsite. Brooks, does that surprise you, or is that what you expected?
No, I think that doesn't surprise me. The number that's a little surprising to me is the people that are doing the destruction themselves. You know, a number of organizations will do this, and they justify it based on costs. You know, say it's cheaper for us to do it in-house. When you think about it, it really isn't, because they're dedicating resources to doing that, and they're exposing their employees to risk if there's some sort of, accident or problem with the destruction. So I think the trend we're seeing is more and more people that are doing it currently in-house are bringing in a third-party vendor to take over that process.
All right.
Anthony,
Go ahead.
Just to drop off of Brooks' statement as well too. Cost at times is a critical element in any organization. And the thing is when I also stated the understanding of what ITAD basically is extremely critical, because when I tell my board of directors, well, if we don't do this properly, we do have a data breach. That data breach coming from a copier, you now have a $1 million data breach penalty associated to the organization. That opens up eyes, because the thing is the understanding of what this is, I don't think is fully embedded into the culture of the organization. It is extremely important when I'm selling an actual product to the board of directors. I have to build a storyline attached to it. And I look at financial, operational, and reputation as well too. When I incorporate those specific items and show facts on any type of data breach and state, we don't need to do this on site we basically need to utilize a vendor that fully meets all certification, that meets our policy and procedure requirements to be successful in getting rid of our IT assets within the organization. Because human element is such an issue at times. We can forget to do a process, maybe forget to destroy or wipe a hard drive. That hard drive goes out with a copier, then you have a data breach in place. So I mean, organizations really need to know at the end of the day, as Brooke stated, you get what you pay for, period. And the thing is either you do it on-site, try to save money and have more associated risks, or you try to do it right and try to get a good vendor to basically offer you the services that you basically need to have a successful ITAD process.
Excellent, excellent. Thank you, gentlemen. Michael, let's stick with you on this question. After a health system finds a vendor who has the right certifications, what advice can you give regarding the rest of the process? What types of things should hospital IT executives consider when doing an RFP, and what kind of due diligence should they perform to find the right vendor partner?
You know, as I stated too, Anthony, it is extremely critical to make sure that the specific vendor that you are looking at basically has all of the current roles and the current certifications basically in place to successfully dispose of your IT asset. And another problem is we forget to incorporate our compliance process in looking at vendors. You know, do they meet the current policies? Do they meet HIPAA high-tech requirements? You know, what is their current off-site process entail? You know, how are they basically wiping disks? What type of guarantee does this organization bring to our group? You know, if a breach did happen with that group, or, you know, you really have to look at all of these specific important aspects before selecting an actual vendor. And the thing is it's extremely critical that all of these specific certifications in place, the proper way of disposing IT assets, the importance of incorporating your CISO to basically reduce risk management and really focusing on the overall assets within the organization and having a visibility of those assets is extremely critical, I think, to the overall success, and really tracking those too and looking at what I call the recycle life cycle of IT assets is starting it from the time it is released to the time it is disposed, putting it in proper documentation and reporting it to the right individuals, which is extremely important, and really addressing your high risks, which basically associate with your full amount of data, your full PHI, etc., your information security, and really looking at any associated lower risks that need to be incorporated into your overall policies and procedures. And what we've done as well too is we've incorporated a lot of governance within the organization. So really having the understanding and the accountability is extremely critical in incorporating those multi-stockholders, because the thing is every different area department basically has associated areas that data does reside in. So individuals understanding, as I stated, operational, financial, reputation, the proper way of reporting and getting rid of equipment is extremely critical to the overall success of your ITAD program.
Anthony, to echo and build a little bit on what Michael said, I think it's important to go, you know, certifications are important, but it's important to go beyond that. I think it's critical to do your own due diligence, to understand how the vendor provides secure chain of custody. What kind of reporting can the vendor provide you? Can they break out individual weights, makes, models, serial numbers? A site visit to the company's facility is definitely an important part of the process. I would interview their existing clients And lastly, I'd review their financial condition and their insurance coverage. In particular, you want to make sure they have errors and omissions insurance to cover a potential data breach, and pollution liability insurance, because that's not covered by a standard commercial liability policy.
Very good, very good. Brooks, let's stick with you on this one. How can healthcare IT executives go about creating a formal ITAD policy, and why is this important? So let's start with you, Brooks, and then Neal, I'm going to come to you.
Sure. So Michael talked a little bit about this earlier, but just to reiterate, I'd say there are two primary reasons why having a formal ITAD policy makes sense. The first is it's important to consistently track IT assets to ensure their efficient use throughout their usable life and to maximize their end-of-life value. According to IDG, companies with a formal ITAD policy in place are more than twice as effective in maximizing resale value of their old IT assets than companies that don't have a policy. I think the second important aspect of this is that standardizing practices across the organization in order to ensure compliance with a growing number of environmental and data privacy regulations such as HIPAA, so that you don't have different parts of the organization having different processes, some being compliant, some not being compliant. Getting that consistency in place is critical, and a policy will allow you to do that.
Very good. Neal, let me actually give a little slight twist on the question. Talk to me about prioritization as a CIO. I mean, this is an important issue, right? It's around security, very important. How do you prioritize this with your time, so many things to do, so many things to take care of? How do you make sure this is, that this is in place and is being done properly?
Oh, I think both Brooks and Michael mentioned governance. Governance is a critical part of this. From a CIO's role, security has become a bigger and bigger slice of the pie in terms of what we're worrying about on a daily basis. And so asset disposal is a piece of that slice of the pie, or asset management overall. So I would say it's important. I think that it's something that as a CIO, I delegate to my infrastructure team and the CISO and others who are stakeholders in this process. And for JFK, that kind of feedback loop feeds into our IT governance process, but it is a critical piece of the overall pie. In terms of prioritization against other things that we worry about as CIOs, I'd say it's in that top tier of things we have to be aware of.
Very good, very good. All right, Brooks, over to you. Remarketing as opposed to recycling IT assets can significantly lower their TCO, as the customer can receive a portion of the remarketing proceeds. How does this process work? Where do the assets go, and how can hospitals navigate these waters?
Sure, and this is important because 30% of all the assets that are going through the ITAD process do have end-of-life value and are remarketed. Basically, at a high level, the assets come in, they're assessed based on their age and condition for their potential remarketing value. All company data is erased. Any identifying labels or markings are removed. The assets that are designated for remarketing are then tested. They're cleaned and they're graded according to condition. And the customer receives credit for a portion of the fair market value of the assets designated for resale. This credit can either be used to offset other processing costs or can just result in a check being sent to the customer. Any assets that have sufficient end-of-life value go for sale, and the channel most likely to yield the highest possible return. So examples of this are retail, through retail stores, through auction, an online e-commerce outlet, wholesale buyers. So there's a variety of different possible distribution channels, and you pick the one where you think you can realize the highest value in a reasonable amount of remarketing time. Lastly, any assets that don't qualify for remarketing need to be recycled in compliance with all federal, state, and local regulations. So just to reemphasize, this is an important part of the process because even though only 30% of the assets collected go through remarketing, they actually represent approximately 70% of the value to the IT asset disposition industry. So, you know, they're small in terms of they're the minority in terms of assets, but they're the majority in terms of the revenue realized by the industry, and, you know, could significantly lower your total cost of ownership.
Very good. Brooks, I want to stick with you. Regarding legislation, what are the major environmental and data privacy regulations that are relevant to ITAD?
Sure. So the big environmental regulation that really kicked off this process is the Resource Conservation and Recovery Act of 1976, which is known by its acronym RCRA. Although it only regulates the disposition of CRT monitors, many states have also introduced legislation concerning recycling and reuse of electronics. And currently 25 states actually have enacted legislation requiring e-waste recycling, and that number is growing. With the exception of California and Utah, all these states use the extended producer responsibility, or EPR, approach. Basically, this requires manufacturers to fund the cost of recycling their products, and they do that by charging a little bit, you know, on top when they sell the product, similar to a deposit on a bottle. You know, in terms of data privacy, you know, there's a real alphabet soup of regulations out there. You're all probably familiar with HIPAA. There are others, FACTA, there's PCI DSS, which is related to, you know, processing credit cards. There's, you know, there's high tech. There's a whole sort of alphabet soup of these different requirements. You know, and it's important to remember that, you know, the fines and the potential liability can be very significant. In the case of HIPAA, there are actually criminal penalties for willful misconduct. So, you know, if you're found to have intentionally caused a data breach, a PHI, you could be spending time in jail. The fines are huge as well. I mean, I'll give you an example. There's a new legislation in Europe known as GDPR, which is going to be enacted in May of next year, where the fine for a breach is 20 million euros, or 4% of global revenue, whichever is higher. So you think about some of these global companies that are doing business around the world, you know, they could potentially face fines, you know, in the hundreds of millions, if not billions of dollars. So it's a pretty critical thing to keep in mind, and I think most surveys show that when you ask customers what they're most concerned about in their ITAD process, data privacy risk really is the #1 factor that most people identify.
Very good. All right, Michael, let's go to you. How can I evaluate my vendor's chain of custody procedures?
You know, when it comes to evaluating the overall vendor's chain of custody procedures, you know, when I look at those specific items and those specific aspects there, I really try to, as I stated, to incorporate my Chief Compliance Officer, my CISO in regards to risk management. So it is extremely important to kind of identify any custody procedures that would be related to the ITAD process. You know, more than likely, at times when it comes to these specific procedures, I really throw those specific responsibilities and those accountable issues to the Chief Compliance Officer within the actual environment itself. And it's really important to really collaborate and have that good accountability and that participation within compliance, and then, of course, within your overall risk management strategy as well.
Brooks?
Sure. You know, there's some questions I think you need to ask as you evaluate your vendor's chain of custody procedures. The first is, do they own their own fleet of vehicles, and do they use their own employees to do the pickups? I think what you'll find is a lot of ITAD firms use 3PLs and temporary employees or employees of trucking companies to do the pickups. And that's obviously a disadvantage because there's no consistency. You'd also want to make sure that employees that are involved in chain of custody are subject to criminal background checks and drug testing. Are the trucks alarmed? Are they tracked via GPS? Does the vendor track the assets all the way from preparation to final destruction? Do they assign a unique tracking number? Do they scan the assets or pallets at key transition points? And is there an auditable workflow? So chain of custody is critical because, again, if an asset gets lost during the ITAD process, if it's unaccounted for, you're facing potential data breach or environmental liability.
You know, and Anthony, just to incorporate Brooke's statement as well, too, the reason why I basically state incorporate your chief compliance officer in regards to it, because we have specific policies and procedures built around our ITAD and our overall vendor assets and our vendor visibility workflow of where the assets are basically going from. It is extremely important that we have an actual business associate agreement between the actual vendor and our organization, that they basically meet all of our requirements in keeping our information safe as well too. And then as Brooks basically stated too, it's really important to kind of determine the overall insurance processes of what that organization has, and of course verifying the overall backgrounds of the individuals that are actually disposing your actual IT assets. So moving forward, I've always looked at it is extremely important to add individuals, as many stakeholders into your organization and into your ITAD process to be successful. And when you incorporate compliance in here, you can make sure that you are hitting all your NIST cybersecurity frameworks that associate with basically wipes of disk, etc. You know, looking at the overall current IT assets within the organizations. And then, of course, if there is a problem, everyone moving forward can basically react to that issue moving into a good scenario, because at the end of the day, we are trying to keep everything as secure as possible. And at times when you basically get an actual vendor that takes your information off-site, you've now created more risks associated to your overall process.
Very good. All right. So our last question is we're running out of time. Please offer some final thoughts, advice, or lessons learned. Neal, let's start with you. Any final thoughts as we leave the audience on how they can move forward with this process in the proper way?
Well, Anthony, I think you heard from both Michael and Brooks. There is a lot to consider in this process. Clearly, there's a wide range of stakeholders who need to be at the table, and a lot of serious work that should be done around policy and procedure, as well as auditability on the back end. And so it really is a program. It's not something that should be treated lightly or be sort of a side thought or an afterthought. It's something you've got to focus real attention on and have a dedicated group of people spending some significant resources on. And to the point that, you know, as CIOs, you have to evaluate whether or not this is something you want to tackle completely on your own or act as a general contractor on, or you want to outsource this all to a firm who's got the ability, the bandwidth, and experience to do this the right way. And those are some things you have to evaluate based on the risk tolerance of your organization.
Michael?
Absolutely. So I always basically state by stating have a good understanding of what ITAD is and your overall, you know, really trying to identify, you know, requirements and goals of your organization. And it's extremely important to build on that governance and really include all the stakeholders involved to basically make your overall process as successful as possible. And it's critical too is, you know, incorporate training, you know, really train your staff and really hold them accountable to their overall aspects, because as I come back to it too, you know, a $1 million breach of a retired copier, having the understanding and building on your cultures ITAD process is really going to be critical to the overall success of your organization, and really incorporating those stakeholders to incorporate better policies and procedures to really help implement processes to evaluate and continually improve the systems is extremely critical.
Very good, Brooks. We'll give you the last word.
Well, I never get the last word. That's great. So I think Neal and Michael both make excellent points. I would just add two other thoughts. The first, and I said this earlier, you get what you pay for in this industry. You know, there's a reason why a vendor offers the lowest price. You know, don't be penny wise and pound foolish. I mean, you wouldn't shop around for an open heart surgeon just based on price. When you think about the significant risks posed by the ITAD process, it probably makes sense to focus on quality as opposed to exclusively on price. The second final thought I'd leave with everyone is to do your own due diligence. You know, certifications are important. They're definitely a part of the process, and they add, you know, comfort. But you really have to kick the tires and audit your vendor, both in the initial RFP process and then on an ongoing basis, just to make sure that everything's being done in the right way and in compliance with your organization's specific requirements.
Excellent. Well, that is about all we had time for today. When you close out your WebEx window, you'll be taken to a post-event survey. Please take a moment to answer that, if you would. Regarding continuing education credits, attending our events gets you 1 CEU towards the CHIME CHCIO certification program. Please let CHIME know you were here, and if you've asked us to do so, we certainly will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll get an email when our archive recording has been posted to our YouTube channel. If you'd like us to produce a webinar on the topic of your choice, you can contact Nancy Wilcox from our team, and you can go to our website to see our upcoming schedule of events. So with that, I want to thank our panel, Neal Ganguly, Michael Archuleta, and Brooks Hoffman. I want to thank Iron Mountain for making the event possible, and I want to thank you, our audience, for attending our events. Everybody have a wonderful day. Thank you.